So yeah, just to start with introductions then. To introduce myself, I'm Ricky Staniland. I'm a physician associate that works in general practice, and I have recently been appointed as a clinical educator with the Greater Manchester Training Hub to look at developing a GP ready programme for physician associates that are new to practice, or primary care, I guess, with the new model of them working throughout PCNs. So the team that I work with directly is Sam Howard, who's an advanced clinical practitioner and clinical lead at the Training Hub. We've got Rob Harris, who does so much of our work, and without him, we wouldn't be able to deliver this programme at all. So I'm really grateful for that and your input, Rob. So welcome. Thank you so much for giving up your time, because I appreciate how busy you all are, especially in practice. So thank you for joining us today. We've done a little bit of introductions in terms of in the group chat. I asked if people could just pop their role and who they were really, so we could get a feel for the audience today. It's great to see people like Kate here from HEE, Natasha from NHSE, us from the Training Hub, and then lots of employers. That's fantastic. The purpose of today really is for me to give a bit of an overview of the GP Ready programme and what really it offers physician associates that are new to practice and primary care. Fundamentally, really, I want to offer an opportunity for question and answers and to get some feedback from yourselves really in terms of what you would ultimately like your PAs or physician associates to get out of the programme if they were to join us and enrol on it. So without further ado, the programme, how it looks at the moment. So it's what we've designed so far provisionally is a 39-week programme which goes over a 1 year time frame. What we've tried to do really is cater that timetable for dates such as summer holidays, pressures where we do appreciate annual leave and absence from practice can be quite inconvenient. So we've tried to cater for that and make a 39-week programme that is flexible around sort of term times and things like that for schools and those that have families. The tutorials then, so we aim to deliver weekly tutorials over that year, and they will generally be on a Friday morning, not between the hours of 9 and 12. And what we envisage really is that will largely be delivered remotely, and that really is because it's a GM-wide programme. We want to offer that flexibility to PAs and employers so that really we can ensure that if they are attending our programme and then have a clinic thereafter, that there's that flexibility for them to be able to finish the educational session and be ready at the practice, say if they've got a clinic, because it can be a nightmare. If we were to base it at one end of Manchester, then of course it would be difficult for PAs that maybe be coming from the other end of Manchester. However, if there are sessions that we would benefit from face-to-face and practical sessions, then of course what we will try to do is accommodate for that, and we'll plan that well in advance so that there's time for it to be logistically thought through. What will it comprise of then? So clinical training on general practice medicine. So you'll see shortly what the overview and the provisional draft of the programme looks like in terms of clinical topics each week. In addition to the general practice medicine, that's all the sort of core modules and topics that we see day in, day out. We'll also have some specialist guest speakers and tutors that will help to cover sort of the more specialist areas of medicine, such as ophthalmology, obstetrics and psychiatry. I've put in brackets here topics to be confirmed. The reason for that is predominantly because what I want is to be guided by the PAs themselves. So those that are on the programme, I want to be guided by what they feel they would benefit from the most in terms of having those external speakers, and equally yourselves really. Certainly when we get to more specialist areas, of course, we all would benefit from that, from those sorts of experts and specialists coming to deliver that training for us. Incorporated into the programme is some leadership training as well, which we'll deliver from within the Greater Manchester Training Hub. Further to that, there's some quality improvement training. So we'll look at auditing, quality improvement, so that, of course, for yourselves as employers, what we can do really is hopefully build clinicians that develop clinicians that are able to apply their skills that they've developed on this programme to be able to carry out audits and clinical quality improvement projects within the practice to meet the practice's needs as well as what the PA's needs are for their development as well. We're offering a peer support and networking, essentially a community of practice really. We're facilitating it through the Greater Manchester Training Hub, and I'll show you briefly what that will look like, so that actually even when they finish the GP Ready programme, it's not the end, and that's not the end of the contact they have with ourselves. Actually what we want is a community of practice that we maintain thereafter, so that actually those individuals feel supported. They've still got that network to be able to tap into for resources, advice, guidance and so on. Opportunities for multi-professional working. So in addition to the PA programme that we're running, we have all other GP Ready programmes for the first contact practitioners, paramedics, dietitians, pharmacy technicians. We also have general practice nursing foundation. So there's lots of opportunity for us to blend the learning within this programme and ensure that actually we utilise our other multi-professional programmes, so that ultimately we learn not only about what we can do to utilise our own sort of profession, but actually how we can work together collaboratively to maximise the work that we carry out in general practice and primary care collectively. And we'll have a platform for shared resources. So what we want to do really is ensure that actually it can be difficult when you're in clinical practice, and certainly I'm sure all clinical supervisors have that, you have your own library of resources and pathways and guidance that you use. What we want to do really is look at developing a shared platform where we can share all of those local pathways, best practice guidance, as well as the weekly class material that we progress throughout the programme. And finally, continuing support and resources following completion of the GP Ready programme. So as I said, I don't want the programme to be the end of our input. I would like it to be that actually we continue to utilise that community of practice and we continue to build that in the future as physician associates embed more in primary care. Eligibility then. So just very briefly, so the eligibility criteria is that we would like PAs essentially to be within 1 year of qualification and registration with the Managed Voluntary Register, which is held at the Royal College of Physicians Faculty of Physician Associates, or a physician associate that's taken up their post in primary care since gaining registration. This would also include PAs that transition from secondary care with a maximum of 3 years experience. And actually what we learned the other day on the PAs webinar is that there's a number of PAs that are out there that are actually very experienced in secondary care, whether that's acute medicine or a specialist area of medicine, and actually are looking to make that transition into primary care, which is really exciting. So we want to be able to open up the offer and ensure that they are included within the GP Ready programme. And finally, they must not have uptaken a preceptorship prior to this in primary care as exclusionary criteria, and they must be working in general practice in Greater Manchester at the moment. Of course, I'm not sure what the offer is from other training hubs, but that's what we're offering at the moment within GM. The course contents then, so I won't go through it too much, but I'll just leave it on here so that what you can see really is that within the first sort of third of the programme, we're looking at induction. The induction will look at the GMC standards, because ultimately the GMC are coming into regulation for physician associates next year, and it's really important that we think about the importance of that within our GP Ready programme, including our RCGP competency framework. So the programme will be mapped to the RCGP's curriculum and competency framework, so that essentially we can ensure that we've met the breadth and depth of the competencies that's required for PAs to be working safely in general practice and primary care. What we'll do as part of the induction is a baseline survey and questionnaire, which I'll briefly talk about shortly. In addition to that, as you can see, we'll cover core topics and modules within general practice medicine. And then as we sort of progress throughout, we'll get into more specialist areas, as you can see. So going more into sort of urology and sexual health and haematology, gynecology, obstetrics, etc. What I would say, though, is that actually at the moment, whilst this is a provisional draft, this is not the set order in which it will be delivered. We'll be guided heavily by the needs of the physician associates that are on the programme in terms of the order in which we will deliver the programme. So it's certainly not set in stone. And then finally, the third term or so is again looking quite specialist, but this is no set strict order. So it may be that actually the needs of the physician associates is that we want to put that MSK in closer to the start. Equally, it may be that actually with an increasing number of FCPs, first contact physios, we're happy for that to be a little bit later down the line. Who knows? But what the most important thing is that we're very, very open to changing the order in which we deliver this programme to meet the needs of the PAs and the individuals themselves. Baseline survey then. So of course, if we're talking about a new clinician to primary care, what we want to do is capture where they're at that moment. So what we're looking at the moment is designing a questionnaire and assessment of their competency and confidence in respect of the RCGP's curriculum framework. So we want to look at essentially how confident they're feeling in respect of specific modules, because what we can then do is ensure that we tailor the programme to meet the needs of all of the individuals collectively, but of course tailor it where possible to individuals' needs. And so to allow us really to be able to ensure that whilst PAs may not be able to attend every session, and the ask is generally that we would like PAs to be attending more than 80% as a minimum, Of course, we would like PAs to be attending the sessions that they feel that they would get the most out of, and perhaps they lack confidence in or need that little bit more in the way of education. So we'll utilise this survey in a way to sort of input how we might structure the course and develop the course, but also how we will evaluate the course to ensure that if we were to deliver it again in the future, it's well informed and based on feedback from previous cohorts and how it's evaluated before. After all, because it is the pilot programme. So why join the GP Ready course then? So it provides educational support that prepares PAs to be GP ready from joining the Managed Voluntary Register. It supplements clinical practice and experience gained within practice. So of course, it allows for an opportunity to reflect on a lot of what you do in general practice, which I'm sure many of us will agree, certainly from a clinical point of view. Quite often I do a lot of reflecting whilst I'm driving home from work or after a long day. I start to think about actually take a step back and think about those cases again. And I hope that this opportunity of this programme will allow for PAs to think about collectively in that group setting with other PAs and other professionals the clinical practice they carried out that week. It provides educational support. So for those of course, the PAs that will be new to primary care, but perhaps very experienced PAs, then of course it provides lots of support that's tailored to how we do medicine within general practice, which can often feel very different, whether it's the logistics of, or whether you come from a specialist area to a generalist area like practice, it can feel quite daunting. So it of course offers an opportunity to support those individuals as well. Provides an opportunity for PAs to work in innovative ways to share best practice knowledge and skills to develop the wider workforce. As we well know, I think there's lots of questions around how does supervision look and what's the scope of practice and where are the boundaries? And what I hope to do really is this programme will allow us to be able to, as a region and across Greater Manchester, look at ensuring that actually we do share that best practice. We do share how at times some of us will be working at the boundaries of our scope of practice, and how do we do that safely, and share what great things and progress some individuals have made. Because actually we will all be at different points, whether you're 6 months into your preceptorship or you're on day one. There's lots of learning to share in that process, and some individuals may have taken up lead roles as that in sort of chronic disease, certain areas of chronic disease, or perhaps safeguarding or other sort of niche areas within general practice. And it's important we share that development really to develop the wider workforce across GM. The peer support network for PAs, as I've previously spoken about and I'll come to shortly, an educational mentorship opportunity. So what I hope to do as part of the GP Ready programme is provide opportunity to come in and observe some of the clinics, to provide some formal feedback, some objective feedback in respect of how the individual's doing. And actually, I certainly know from when I was on preceptorship, I found it really useful to have someone come in and provide feedback for a whole clinic and some real sort of pearls and things that I hadn't really thought about, because I'd never actually had someone sit in and tell me that, oh, you should try and read code in this way, or prioritize a consultation in this way. Maybe you could slightly alter your documentation. Sometimes it's the finer details that make a big difference to us in how we work. And it's not always so easy for yourselves as clinical supervisors or your GPs to be able to sit in the consultations, but actually we hope to provide that as part of the GP Ready programme. Of course, we'll support them with their CPD diaries throughout their education, so majority of which they will be able to submit their CPD through just enrolling on the GP Ready course. So hopefully their first year of their CPD should be provided and will be provided through the GP Ready programme. We've developed a Facebook group, and most of the PAs, and certainly we'll filter it out through sort of comms, but what we've developed really is a peer support group. It's a Facebook group at the moment. I think we've possibly got about 12 PAs that are working in primary care across GM, but we only went live a couple of days ago, and already we're sharing sort of opportunities for CPD. So it'll be a great platform for us to be able to continue to share and keep really that community of practice going after the GP Ready programme. Benefits for the practice of PCN then. So training is fully funded. As I've previously spoken about, there's quality improvement and audit training. We'll look to develop the leadership and the clinical supervision skills. So if you do have students coming into practice, we'll hopefully have your PAs after the GP Ready programme will be able to clinically supervise those students and allow for students to be supervised appropriately in practice. We'll have regularly weekly sessions to allow for resource planning in advance. So we'll let yourselves know as employers well in advance of how the timetable looks, so that of course you can logistically make sure that it doesn't clash with your rotas, leave, absence where possible. Of course, we'll give you that as soon as we can, and as far in advance as we possibly can. And again, I think there's a lot to learn for sort of employers, really, is that actually it will be great for us to demonstrate how maybe one PCN are doing something in a really innovative way and it's working really well. Equally, it may be a problem for another PCN or a practice. And so let's share that learning, and this will be an opportunity for us to do it throughout this programme. It creates an attractive recruitment and retention package, because ultimately the biggest risk to primary care is the fact that sometimes we hear more often than not that PAs don't feel supported in the way. And actually it's daunting being in a new role, in a new environment, in an ever-changing model, which is with the birth of primary care networks and them being so infant, there's lots to be worked out. But what we want to do really is, if we can offer that consistent level of support for the PAs, then I think that would be really attractive in terms of retaining those individuals as well. So of course, as I've talked about, lots of sharing of best practice, educational mentorship, as I've spoke about previously with myself and the other clinical educators within the hub. We're more than happy to come out and provide that mentorship and that observation and feedback. And of course, we're all about developing the role of the PA to meet the needs of the practice and or PCN. So it's looking at what are the needs of your practice, PCN, and what can the PA offer that service. Because actually, I think we need to we often talk about the limitations of PAs, but actually it's probably best to think about it. How can you best utilize a PA? And I promise you that if thought through properly, the scope is unlimited, really, in terms of how things can do. It just needs thinking through about how does that supervision look, and has it been done somewhere else before? What was the learning? What was the barriers? And actually, we can offer so much in the way of supporting that process. If there's something that you think your PA could benefit, well, we can happily discuss that with yourselves, really, to look at how that might work. This is the 5K funding process. So Kate Catterall's on the call if there's any specific questions, and there's the email of Alma Egan from HEE about the £5,000 funding process for physician associates. I believe it meets the same eligibility criteria, but if there are any questions, pop them in the chat, and of course we can come to them. What's next? So if you are interested and or have a PA that meets the eligibility criteria and you want to enroll them onto our program, then of course we've got forms to fill in that you can access via the link on the page, and or feel free to drop us an email if you've got any questions at all at Greater Manchester Training Hub. The generic email's there. If you put it for the attention of myself or Rob, we'll certainly pick it up and get back to you as soon as possible. Stop sharing my screen now so we can ask any questions. Kate, have you got any questions at all, or are you happy with?
No, I'd say in a personal experience, I did the preceptorship when I first started, and I think it was really invaluable, and I think you'll probably agree, Ricky, there's so much you get out of actually having that network and a community practice to kind of meet with PAs who are in a similar situation, but also having a set curriculum actually has a massive benefit in terms of your learning. And, you can work with your clinician, your supervisor in terms of developing your curriculum around it. So if you know the PA is going to have education respiratory, you can pull some respiratory patients and really get it all lined up really nicely as well. So get the real practice experience linked in with the education. But yeah, I just can't express enough to try and get signed up to this 5K funding. It is limited funding, and it's really great just to have this education support package that HE can offer in line with kind of Ricky's fantastic programme as well.
I think that's a really good point about the clinical supervision in practice as well. Of course, I know some of the students may have had lots of support already prior to coming on the programme, so I guess then it can be sort of thought through about which elements of the course would be most appropriate for them at that point. It's a really good point. Thank you. That's great. Oh, have we got a question from, is it AJ?
Yeah, Ricky, quick question. The program is funded as in for the teaching and things. Yeah. But is there any funding for the practices?
Rob, were you about to answer that? Sorry, I didn't know.
I can do. So that would be for the funding for the practices would be the 5K from HEE. So because although we're calling it a GP ready program, it's a preceptorship, so it should be eligible. So you'll get 5K for that. So that's the funding on top of what we provide, but we don't provide the training club itself isn't providing any money. The funding will come through HE, but the details are on our website.
Yeah, I mean, if somebody could just send it to us at the
Yeah.
PCN level, we can disseminate. It's just that I think because there'll be so many PAs, will all be deployed in practices, they'll be getting varying levels of supervision. Grant is in our practice. We debrief both for the morning and afternoon sessions. We got a separate thing going on. So I'm just trying to avoid duplication.
Yeah.
So that way, I think the 20% slack, I think, will be really helpful so that they don't go and have a bit of repetition, blah, 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 blah. So that information, if we could just ping it across, and if I could just put my email in the chat thingy,
Please
and
do.
then I could just disseminate it to everybody else.
Yeah.
Thanks a lot.
And certainly, I guess it makes a good point in terms of if you've got a physician associate that's sort of later down that sort of year, that perhaps they've been with you for quite a while. It may be that we can't, onboard them for 80% of it, but certainly put an expression of interest in, and we can always come to some agreement if there is exceptions. We appreciate it's not always black and white with eligibility criteria and things like that. So we're more than happy to cater where possible for individual circumstances.
We've just got a couple of questions in the chat. So will there be any qualification achieved after completing the course?
So at the moment, with it being a pilot scheme, and I guess that at the moment there isn't any formal qualification. However, what we're looking to in the future is essentially that the purpose of me mapping it to the RCGP's curriculum and competency framework is for us to look for accreditation from the RCGP really going forward, so that we can get it acknowledged that actually the breadth and depth of what we offer as part of this program is invaluable really. But unfortunately, at the moment, there is no formal qualification.
And though I should add, so what we are hoping to do as part of the leadership training is to put all the PAs through the clinical supervision course, which will be HE approved. So we are hoping to have everyone, which is, I don't know if it's an exact qualification or a certificate, because I'm not au fait. You might know better than me, Ricky. But hopefully there will be clinical supervisors by the end of the course too. So another question in there is, someone finds it difficult from what to expect from their PAs, their limits, and whether there's a way of getting it standardized.
Yeah, I mean, I think that's a great question really, and it's something we're quite often asked, and I guess it's so difficult to answer without sort of saying it's so individual and based on the prior experiences of the PA and sort of where they're up to. What I want to do though is, as discussed really, is look to where possible make the program as supportive as possible on an individual level, so we tailor it to the needs of the individual. And we can certainly support you in terms of looking at those limits and standardizing it for yourself by coming into practice. I'm happy to meet with yourselves and the PAs and look at how you're working at the moment and how we might be able to support you and scope out that practice going forward. So I'm more than happy to have a conversation outside of this forum if that'd be beneficial.
Thank you. So next question, will this be occurring in their dedicated SPA time?
So in terms of their dedicated time then, so I don't know if that sort of is that what you're describing as the educational session that's required as part of the preceptorship that HEE is that am I right in thinking that? Kate, do you know what's the SPA? Is that a term that you're familiar with?
Assuming it means the spare. I'm assuming. So yeah, I think it's that half a day. That's when it should be expected that it should do this program in the half a day session that they get.
Yeah.
Next question then is, would it give them an opportunity to become prescribers?
Great question. So obviously that's beyond what, I guess that's a bigger working project and program, isn't it really? So as part of what the work that the GMC is doing with the Department of Health and Social Care, of course that's being driven nationally from our regulatory body that's coming into place next autumn. So I guess really we're constantly getting updates from the GMC in terms of where they're up to with regulation and how prescribing will look in the future. But this sort of program is not specifically around prescribing, although of course within every module and element we will always discuss safe prescribing and pharmacology associated with it. So it will certainly feed into perhaps the point at which prescribing does become a process we can sort of formally qualify with, if that makes sense.
So no more questions in the chat at the moment. Has anyone got anything? Oh, here we go.
Any already prescribers? No. So I guess that's really just because at the moment there's no formal regulatory body. So whilst there's a managed voluntary register at the Royal College of Physicians, until the GMC regulate next autumn, there is not the option to be able to do sort of non-medical prescribing at the moment. However, I think now more than ever is an important time to develop the PAs, because ultimately what you're going to see happen is quite quickly, once the GMC are regulating us in a year's time, we'll probably see quite quickly come after things like prescribing and so on and so forth. But as it stands, no PA can technically prescribe at present. Of course, we'll share the recording, won't we, Rob?
Yeah.
That's great.
That.
Thank you all so much. I'm more than happy to meet on a one-to-one basis, or if you've got any questions, drop us an email and we'll get back to you as soon as possible. Thank you all so much.
Oh gosh, Garner, would it address home visits?
Would it address home visits? I mean, the programme will always, I guess as part of the clinical modules we'll cover, we'll of course look at as part of the urgent care and things like that, how we carry out home visits. But certainly I know of many PAs that carry out home visits, including myself. Kate does as well. I know some PAs that do care homes, for example, and largely that's all home visits. So we'll certainly be able to look at logistics of home visits and how PAs can facilitate that.
And I suppose it comes under the managing kind of diagnostic uncertainty as well, doesn't it, a little bit, Ricky, that you're kind of going to cover as part of the programme?
Yeah, absolutely. Fantastic. Thank you all very much.
Thank you for coming.